All right, so have you ever wondered if we can actually tell if a dog's brain is herniating just by looking at their blood pressure and heart rate while they're under anesthesia?
Oh, that's a great question. And, it's a question that a lot of veterinary anesthesiologists think about.
And it's one that a recent study tackled.
Yeah, from 2024 in the journal Veterinary Anesthesia and Analgesia.
Oh, very cool.
So in this deep dive, we're going to really unpack this study.
All right, let's do it.
And figure out, can we really rely on the Cushing reflex or CR to tell us if something's going on with the brain up there?
So essentially what they did in this study was they took 137 dogs with suspected brain issues.
Right.
And these dogs were already scheduled for MRIs.
Right.
And they divided them into groups based on the MRI findings.
So those with herniation.
Okay.
Those with other brain abnormalities, but no herniation.
Yeah.
And then those lucky pups with perfectly normal brains.
So a good mix there.
Yeah. And then to make things even more interesting, they had a panel of veterinary anesthesiologists review the dog's anesthetic records. But here's the kicker. They did this without knowing the MRI results.
Oh, so they were completely blind.
Totally blind.
Oh, wow.
They had to determine whether each dog showed signs of this Cushing reflex based only on, the heart rate, the blood pressure, all that stuff, just from the anesthesia record.
Oh, that's super interesting to kind of get rid of that bias.
Absolutely. It's a true blind test for the brain.
I like it, a blind test for the brain.
Mm-hmm.
All right, so before we get into all the details of this study,
Yeah.
we really need to take a step back and understand what is the Cushing reflex?
Right. What is this thing?
What's going on?
So think of the skull as like
a hard container.
a rigid container, that's a better word,
Okay.
housing the brain blood and that cerebrospinal fluid.
Right.
And when something, increases the pressure inside that container,
Right.
like if there's swelling or a tumor or, something's going on, it triggers all these physiological changes. And that's what we call the Cushing reflex.
So it's basically like the body's way of kind of sounding an alarm.
Exactly.
Like, hey, something's not right in here.
Yeah, like a built-in alarm system. But instead of a siren, you get these funky changes in blood pressure and heart rate.
Right. So instead of, hearing the alarm, it's like the body is reacting in a way.
Exactly. And those changes are pretty distinct.
Okay.
You get irregular breathing,
Okay.
a sudden jump in blood pressure, especially that top number, the systolic pressure.
Oh, okay.
And then you get this wide gap between the systolic and diastolic pressure. So that's called a wide pulse pressure.
Oh.
And then the heart rate slows down, and that's called bradycardia.
So if we're looking at a dog under anesthesia and all of a sudden we see all of these things happening at the same time,
Yeah.
that's a pretty big red flag.
Huge red flag. It's like, whoa, something might be seriously wrong neurologically.
Right. And we need to pay attention.
Yeah.
Okay. So the goal of this study was, can we really rely on this Cushing reflex to be like, yep, there's brain herniation happening?
Can we hang our hat on that?
Exactly.
And so let's get to the juicy part.
Okay. So tell me, what did they find?
Okay, so this is where things get a little tricky and a little more complicated than we might expect.
Okay.
They actually found that just because a dog has the Cushing reflex doesn't necessarily mean there's herniation.
What?
Yeah, I know, right?
So even if the dog is showing all the signs,
Yeah, classic CR signs.
they might not have a herniated brain.
That's exactly what they found. So out of 9 dogs that were identified as likely having CR based on, all those numbers,
Great.
only 3 of them actually had herniation on the MRI.
So 6 of those dogs didn't have it.
Exactly.
Wow.
So that was pretty surprising.
Very surprising.
It's not as straightforward as we thought.
Yeah. So what about on the flip side?
Yeah.
Were there any dogs that actually had herniation but didn't show any signs of the Cushing reflex?
That's the other interesting thing here.
Yeah.
Some dogs with clear herniation on the MRI, like you look at the picture and there it is.
Mm-hmm.
They didn't show any of those classic CR signs.
Oh, my gosh.
And to make it even more interesting,
Okay.
some dogs with perfectly normal brains
Mm-hmm.
showed signs of CR.
Oh, my gosh. This is like a mixed bag.
It's a mixed bag.
It's like the reflex is playing hide and seek.
I know, right?
It's so confusing. So what could explain this? Why are some dogs with herniation not showing signs and some with normal brains are?
Right. It's like, what's going on?
What's happening?
So to really figure that out, we need to dig a little deeper
Okay.
into, the nuances of how the brain actually works. And we need to think about some of the limitations of the study itself.
Okay.
No study is perfect.
Of course.
So there are a few things that might have kind of muddied the waters a little bit.
Right.
So for instance, the study didn't use standardized anesthetic protocols for all the dogs,
Okay.
meaning that each dog probably got a slightly different mix of drugs, different anesthetic gases.
So like a different cocktail.
Exactly.
Yeah.
Each dog had its own special cocktail.
Okay, and that makes sense because those drugs can definitely affect blood pressure and heart rate.
Totally. And because they were all different, it makes it hard to compare,
Oh, yeah.
apples to
No,
apples.
you can't really compare them if they're all on different things.
Exactly. So it's like trying to judge a singing competition where everyone's singing in a different language. It's
Yeah.
like, who's really hitting those high notes?
You can't even tell.
Right.
Okay, so different anesthesia protocols. What else?
Another thing is that they relied on oscillometric blood pressure measurements.
Okay.
So that's the typical blood pressure we get with, a cuff around a limb,
Right.
which are convenient,
Yeah.
but not always as accurate as like a direct blood pressure measurement where you have like a catheter in an artery.
Oh, so they weren't doing the most accurate type of blood pressure.
Yeah, it could have been more precise.
Okay.
And that could have definitely affected the results.
All right, so we have the different anesthesia and then we have the blood pressure measurements.
Right. And then the last piece of the puzzle
Okay.
is that diagnosing CR based only on, looking at the anesthetic record, it's kind of subjective.
Oh, yeah, I can see that.
It relies on the anesthesiologist's interpretation
Right.
of these changes in vital signs.
And those can change all the time.
Exactly. And so this subjectivity, while it's unavoidable to some extent, it makes it hard to say definitively, yep, that was CR, or no, that wasn't.
All right, so I think we have to keep these limitations in mind.
Definitely.
That the Cushing reflex isn't a guarantee.
Right.
It's not like a 100% for sure thing.
Not a foolproof marker.
Yeah.
Yeah.
It's a valuable clue.
A clue,
But it's not the whole story.
not the whole story.
It's not the whole mystery.
Exactly.
So we have to look at the bigger picture.
Yeah.
Including, the neurological exam,
Right.
the history,
Yeah,
and, ideally advanced imaging like an MRI.
of course.
Uh.
Which, speaking of, the study also touches on this fascinating concept called the Monroe-Kelly doctrine.
Oh, yeah.
Have you heard of that?
I have the Monroe-Kelly doctrine.
Yeah, it describes the skull as that rigid container, right?
Right, like we were talking about before.
Yes, exactly.
So how does this relate to, like, those dogs that had herniation but didn't show the Cushing reflex?
That's a great question, and that's what we're going to get into next.
All right, let's do it.
So the Monroe-Kelly doctrine, it's basically saying that you have this rigid container, the skull,
Right.
and it's filled with, the brain tissue, blood, and cerebrospinal fluid.
Right. Those three things.
Those three players. And the idea is that if one of these things increases in volume,
Right.
the others have to decrease
It make room.
exactly to keep the pressure stable.
So it's like a balancing act.
Yeah, like a delicate dance happening inside the skull.
Right. So if the brain is swelling,
Uh-huh.
the body tries to compensate by decreasing the blood or the fluid.
Exactly. That's the classic way we think about it.
Okay.
But there's some newer research suggesting that, maybe it's not as strict as we thought.
Oh, really?
Yeah. Especially if the pressure increase happens slowly.
Oh, interesting. So the brain can maybe adapt a little bit?
Yeah, it's got some wiggle room.
Wriggle room. So the skull isn't as rigid as we once thought.
Well, the skull is still pretty solid,
Okay.
but the brain can kind of shift things around,
Okay.
maybe redistribute some fluid, even subtly remodel the bone over time.
Wow, the brain is incredible.
It's like this master adapter.
So maybe that explains why some of those dogs with herniation
Uh-huh.
didn't show the Cushing reflex.
Exactly. Maybe their brains had already adapted.
Right, because that had happened over time.
Exactly. They were already compensating.
So that brings us back to the point that relying just on those physiological signs,
Mhm.
like the Cushing reflex,
Mhm.
it's not enough.
It's not the be-all and end-all.
You really need to look at the whole clinical picture.
Right. It's just one piece of the puzzle.
Like a puzzle piece.
Exactly. You got to look at the whole picture.
So what else should vets be looking for?
Well, a good neurological exam is super important.
Okay.
Looking at their mental state, their cranial nerves, how they're walking, their posture, their reflexes.
Right.
All those
Or those
things.
little subtle things.
Exactly, because those can give us early clues.
Right. Even before the Cushing reflex shows up.
Exactly. So even if the blood pressure and heart rate look good under anesthesia, we still got to pay attention to all those neurological details.
So it's like looking for those little footprints at a crime scene.
Right, even if the big obvious evidence isn't there.
Exactly. And of course, getting a good history from the owner.
Oh, yeah, that's crucial.
They might notice things that we don't see in the clinic.
Absolutely. They're with the dog all the time.
Right.
So they might notice changes in appetite, activity level, sleep, even bathroom habits.
Right. And all of those are little clues.
Important clues. And then, of course, we have advanced imaging like MRI
Right.
to actually see what's happening in there.
That's the gold standard, really. Right. But I imagine that's not always available.
Yeah, you're right. It can be expensive.
Right.
And not every clinic has it.
So what do you do in those cases?
Well, sometimes we have to make tough decisions
Right.
based on the information we do have.
Uh-huh.
Maybe we'll look at blood work.
Okay.
Maybe we'll do a cerebrospinal fluid tap.
Okay.
Just to try and get more information.
To put those pieces of the puzzle together.
Exactly. It's all about using our clinical judgment.
Yeah. It's a lot of pressure on the vet.
It can be, but that's why it's so important to stay up to date on the latest research like this study.
So we can make the best decisions.
Exactly. It's a constant learning process.
So kind of like how the brain adapts.
Exactly. We have to adapt too.
So now that we know that relying only on the Cushing reflex is risky,
right,
what should vets be doing differently?
I think the big takeaway is don't rely on just one thing.
Okay.
It's about looking at everything.
The whole picture.
The whole picture, gathering all the clues.
Like a detective.
Exactly. We're all detectives in a way.
So we need to individualize our approach.
Exactly. One size doesn't fit all.
And that starts with a neuro exam.
Yes. Be thorough. Look for those subtle signs.
Okay.
Be observant.
So sharp eyes are important.
Absolutely. And sharp ears too.
Oh, right. Because we need to listen to the owner.
Exactly.
Wow.
They have so much valuable information.
It's like interviewing a witness.
That's a great analogy.
And then when it's possible, get that MRI.
Yes, that can really give us a clear picture.
To see what's happened.
And help us make the best treatment plan.
So it's really a team effort.
It is the vet, the owner, the technology.
All working together.
To solve the mystery.
And help our furry friends.
Exactly. And speaking of helping,
yes,
let's talk about what we can actually do to treat brain herniation.
Okay, let's dive into treatment.
Yeah.
All right, so let's talk about treatment. What can we actually do to help these dogs once we know they have brain herniation?
Well, it really depends on, what's causing the herniation in the first place, how severe it is, and the overall health of the dog.
Right, makes sense.
But the main goal is always the same. We got to relieve that pressure inside the skull.
Right, to protect the brain.
Exactly, prevent further damage.
So what are some of the tools that vets use?
Well, one of the most common things is medications to reduce the swelling.
Okay.
So drugs like mannitol or hypertonic saline, they're like little osmotic sponges. They pull water out of the brain tissue.
Oh, so they're like making more space.
Exactly, giving the brain some breathing room.
I like that breathing room.
And then we also use corticosteroids to reduce inflammation and swelling. And sometimes we might use anticonvulsants to prevent seizures.
Oh, right, because seizures can happen with all that pressure.
Exactly. It's all about trying to manage those complications.
So what if medications aren't enough?
Right. Well, in more severe cases, or if it's caused by like a tumor, then we might have to go in surgically.
To remove it?
Yeah, to remove the source of the pressure.
That sounds risky.
It can be, but sometimes it's the only option.
The only way to save the dog.
Exactly. And this really highlights why it's so important to catch it early.
Right.
The sooner we diagnose it, the better the chances of a good outcome.
Because the longer we wait.
Yeah, the more damage can happen.
And the harder it is to fix.
Exactly.
Yeah.
So studies like the one we've been talking about, they're so important.
Right.
Because they help us get better at diagnosing this.
So we can treat it faster?
Exactly. It's all about improving our skills and knowledge.
So really it all comes down to this idea that veterinary medicine is always changing.
Absolutely. We're always learning new things.
It's a constantly evolving field.
And it's exciting because there's so many new discoveries and new treatments all the time.
Right. Who knows what the future holds?
I know, right?
Yeah.
Maybe we'll be able to monitor brain pressure without even having to do anything invasive.
Oh, wow.
Or maybe we'll have genetic tests to tell us which dogs are at risk.
That'd be amazing.
It's really an incredible time to be in this field.
Well, I think our brains are full after this deep dive.
I know, mine is too.
We've learned so much about the Cushing reflex and brain herniation.
It's been a fascinating journey.
And for all of our listeners out there,
yeah,
keep asking those questions.
Don't be afraid to be curious.
And keep learning about veterinary neurology.
Because the more we know, the better we can care for our furry friends.
All right, well, on that note, I think it's time to wrap up this episode of The Deep Dive.
Thanks for joining us.
We hope you enjoyed it and that you learned something new.
And remember, from Vet Neurojar, keep those minds-inspired hearts light and tails wagging.